big news yesterday on the healthcare front. At our White House press briefing, Jay Carney started out by saying, before I take your questions, I just want to crow a little bit. He didn't say that, but that's what he wanted to do. That's what he did. Crow a little bit about the CBO, Congressional Budget Office report yesterday coming out on Obamacare. Take it from there.
Sebelius retires and the good news just comes flooding in.
Interesting that way, isn't it? Yeah.
From the Congressional Budget Office finds that premiums came in so much lower than they expected back in February of 2010, their last report, that now they project that in 2014, the government will save about $5 billion, and over 10 years, it will save $104 billion. Now, this is, I think, fairly remarkable because you had the administration from the very beginning arguing that in certain areas of the country where there's a lot of different insurers competing for your business, that you're going to see lower premiums than what the CBO projected. And that's, in fact, what has happened. And those lower premiums and higher tax revenues from this tax on high-cost plans that's in place is really saving the government money. And the other part of the report that
But just to stop you right there. I mean, it is a big deal.
Oh, it's a very big deal.
Saving $104 billion.
And that's on top of the deficit reduction that's already part of the law because you have higher offsets than you have spending.
So we remember the criticism going into Obamacare was, and I know we're going to get to this in just a second, nobody would sign up. I mean, Republicans actually said, nobody will sign up. Nobody wants this. But, well, hello. And then the other criticism was, it's going to bankrupt us, right? It's going to cost too much money. And now the CBO, again, the Congressional Budget Office, this is not the White House, the Congressional Budget Office, strictly, fiercely nonpartisan, says that, in fact, it's going to save $104 billion over the next 10 years.
Yes, and on top of the deficit reduction, which I think is 104 over 10, if I'm not mistaken, from the latest report. So then it looks into the future, and this is where it's always a little tricky, right? Because CBO, its job is to predict macro trends, and sometimes it gets them right, sometimes it gets them wrong. It looked into 2015 and said, well, what are the premiums going to be in 2015? Because you've seen all the reports that you're going to have a huge rate shock and premiums are going to skyrocket and yada, yada, yada. Well, CBO looked at this and said that there's no real evidence to show that you're going to see huge increases. Now, premiums might increase in certain parts of the country where there's not a lot of insurer competition. It may decrease in others, but on average, the national average, they expect that premium to increase about by $100. So not a lot. And they think that because all of the people who were really, really sick and waiting for coverage and really needed coverage, because they signed early on in October, November, and December, as soon as possible, because they really needed that coverage, that all the future beneficiaries coming in 2015, 2016, 2017, and onward are going to be healthier. And because that healthier mix is going to come in, it's going to stabilize the risk pool, the premiums. Now, the other, of course, factor here is the underlying healthcare costs. And that's what's increased premiums year after year. Before the healthcare law, it'll continue to do so after the healthcare law. And that's going to be the real challenge, getting that down so that the increase year after year is smaller than expected.
And on the population front, if you will, or the enrollment front, the CBO report says when you add up those who signed up on the exchange, those who have coverage now through expanded Medicaid programs, and young people who are able to stay on their parents' plan until they're 26, they're talking 12 million people.
12
in the first year.
People.
12 million, not 7, not 6, 12 million people, which is more than anybody projected, certainly more than CBO projected, more than the administration projected.
Well, I don't know if it's more than CBO, because CBO had numbers that it had 7 million. The exchange, I think it had about 13 million Medicaid when it thought that everyone was going to do Medicaid expansion. So, but on Thursday, the administration's coming out with the enrollment numbers for the entire period of October through March 31st. And what those numbers reveal, I think, that's going to be the real tell. What's the demographics of the people who are coming in? Are they healthy? What are they? Are they young, old? number one. Number two, I think how does it split up? Who's in the exchanges? Who's in Medicaid? It's going to be real interesting, and I think it's going to be, for the most part, another good day, news day for Obamacare, and another challenge for Republicans to try to find some kind of angle to push their case for repeal.
So bottom line with the CBO report, just out yesterday, that the Affordable Care Act will cover more people and cost less money
than they originally thought.